Get your guy. Hey, precious girl. Hello.
Hi. Acquired cranial asymmetry, or positional head flattening, is prevalent in infants today. This is largely attributed to the supine sleep position brought by the Back to Sleep campaign in the early 90s, recommended for infant safety. This asymmetry, or head flattening, is called plagiocephaly. It can also occur in conjunction with shortening of one side of the neck muscles, the sternocleidomastoid, called torticollis. These conditions can become permanent, so prevention and early detection are important. Babies' heads are soft and malleable. My goal today is to show you different positions you can hold and interact with your baby in order to keep their heads nice and round. These tools can be used as early as 2 weeks and should be continued until your baby is at least a year old. This is Jewel. She's going to be showing us some of the things you can do at home with your baby for prevention and early intervention. One of the easiest ways to change position during feeding or holding is to simply switch arms so your baby is facing you from the opposite direction so that their heads can rest differently in your arms. If you want to keep your baby in your dominant arm for feeding, you can put them into what is known as a football hold, where the baby's body wraps around your side. This puts the baby facing the other direction. This can be done with both breast and bottle feeding. There are many ways you can hold your baby to keep pressure off the back of the head. First, you can have them lean against you, tummy to chest, making sure their face is clearing your shoulder so they're able to breathe and look around. You can also walk around in this position for a younger baby. Next, you can put them in a supported sitting position in your lap or on a flat surface so they're able to look around at the surrounding environment. Your lap is also a good way to get your baby used to tummy time. You can put them across your lap for short periods of time to help them get used to being on their tummies while still being held. Be sure to give your baby's arm a surface to prop themselves. Lastly, you can put your baby on his or her back while in your lap. Interact with them in all directions, using either your face or a toy to encourage them to turn their heads both to the left and to the right. If they have a side preference, focus on having them look more to the less favored side. When going through diaper changes, you can switch the side of the table that their head is on so that they are able to look both ways evenly. Tummy time is important to prevent your baby's head from developing flat spots. Placing your baby on his or her stomach while they are awake and supervised can help your baby strengthen head, neck, and upper body muscles. Tummy time builds the strength and coordination for rolling over, reaching, crawling, and playing. It develops the muscles needed to promote motor skills. While in tummy time, put toys in an arch around them to encourage them to look and play in all directions. If your baby tends to favor one side, place their toys on the opposite side to encourage looking and interacting the other direction. Start slowly, keeping them on their tummy for a few seconds at a time, letting them rest frequently until they build their endurance for longer. You want your baby to enjoy being on their tummies, so interact and play with them as often as you can. Always roll in and out of tummy time. If they start crying, do not pick them up immediately. Roll them on their back before picking them up so that they do not learn they can cry to get out of practicing. The infant's chest and tummy can be supported over a boppy pillow to assist with tummy time progression, but make sure that her arms are forward so that she can reach for toys or push through them. You can also use rolled blankets, towels, or washcloths. The baby may need to be a little older, around 3 or more months, in order to be big enough to do this. When the baby is on their back, you can either use a toy or your face to have them look in all directions. This also sets them up to keep turning to roll over. You can have things above so that the baby is able to see and interact on both sides. See how she's looking and wants to reach? If your baby is favoring one side, you can always take off that side so that to have her look the other way. Peak occurrence of plagiocephaly happens when your baby is about 4 to 6 months old, so it's important to regularly check your baby's head for any unevenness. You can look over your baby's head when facing away from you, and you can look for flattening on the back, any of the sides, the front of the head, lack of hair in one spot, any unevenness from ears side to side, or any uneven facial features. If you think there's a flat spot on your baby's head, you can monitor it by taking photos. If the spot shows no change or worsens over a couple weeks, contact your doctor. Thank you for watching this video on prevention and early intervention. And thank you to Jewel, her parents, and the whole family, the Division of Physical Therapy at UNC, for making this possible. Say bye!